me here in the studio, New South Wales Liberal MP Jason Falinski and Victorian Labor MP Peter Murphy.
Hello.
Who've just been freed from 2 weeks in quarantine.
Yes, you think you're excited to have people in the studio.
You're excited to see people.
Where did you quarantine?
At home in Frankston.
With your family?
Yeah, with my husband and my 2 puppies.
All right, we'll get to that in 1 second. So I just want to tell our viewers
Sorry, I didn't mean to take over
No, it's fine. You can take over the interview. But just for our viewers at home, we are conducting this interview under COVID-19 restrictions, 1.5 metres apart and in a room that adheres to the 1 person per 4 square metre rule. But now we have the formalities out of the way. What was 2 weeks in quarantine like?
Look, it was a bit of an imposition, to be honest, but so many people going through so much worse, you know, in Melbourne and elsewhere that I just don't think it's right for politicians to complain.
Yeah, but you weren't actually allowed to leave your house for 2 weeks.
No. So, I mean, the people that found it the hardest, well, I guess they're not people. I treat them like people, were my puppies.
Right, they just had the kind of house to do their walks in each
Bert
day.
and Ernie, 7-month-old Labradors.
Oh gosh, okay, yeah, a lot of energy.
Tough for a 7-month
But actually, it's going to get even harder for MPs as the year progresses, because from October, Parliament's sitting basically every second week. So there are some who might actually need to self-quarantine for, you know, months on end.
I think actually we're going to have to very seriously look at not only the sitting schedule, and thankfully we're now able to video in, which is, you know, 2020, thank goodness we can actually do that.
But you think, fingers crossed.
Yeah, that's right. Question time is the big test, so we'll just hold
I choose
on
to think our colleagues
judgment.
are better than the House of Lords.
Well, but have you seen the technology we've used?
No.
I mean, it keeps falling over. I mean, I've been...
Oh, has it? So
the committees that we've had where we've used the WebEx stuff, it falls over all the time.
And why? Is it the technology or is it the internet coverage?
I'd say it's the servers inside the... I mean, we didn't expect to be doing this. We've given priority to security.
You're to blame the NBN, right? Because your government.
Yeah, well, fair enough. Hang on, wasn't it Kevin Rudd's idea?
Anyway, we'll get away from that because there is some serious business of Parliament to actually discuss. But actually, just to quickly ask you about that, do you think that we do need to be looking at the sitting calendar if it is the fact that...
Oh, absolutely.
Right.
Absolutely.
Yeah. So they have it more spread out?
Like, it's just not right. I mean, I know there's sort of an argument, which is MPs, we're expecting other people to self-isolate for 2 weeks, but people who we expect to cross borders, like truck drivers, etc., we're not expecting them to self-isolate every time they do that, and I understand the reasons for that. We're actually forced to cross borders. I'm in New South Wales, but we're actually forcing people to cross borders, and I don't think it's right on families, on friends, on members of Parliament and our staff as human beings to make people isolate between every period. Yeah. What you're basically asking people to do is come to Canberra for 6 months.
Yeah,
I think that's tough.
Well, it's a big ask, and obviously, was it something that you could do?
6 months.
Yeah.
No, particularly not in normal circumstances where you actually need to be in your community. And again, at the moment, we're in a different circumstance in Melbourne or in Frankston, of course, because there isn't any community activity. Yeah. If I needed to come here for 4 weeks at the end of the year to be able to be here for the budget, which is a really important sitting, and other weeks, then I would do that. But I think that next year is going to be a whole new ball game, and there's going to have to be a lot of thought put into. Maybe a month would be.
Like a month of sittings, yeah.
I mean, perhaps, but we haven't talked about it.
Yeah.
I mean, that's one of the problems. There are so many issues that need some planning, you know. Sittings of Parliament are just one of them.
Yeah, well, look, we've got remote sittings done, so that's the first, come off the rank. But
the other thing I was going to say, and I'm sure you've had, and Peter's been here a year, I've been here 4 years, I've never seen our community need us more at the moment, especially with people trying to get out and then, more importantly, get back in. We are needed in our communities more than ever. So to say to MPs, like this sort of idea that we're only working when we're in Canberra, at the moment in particular, has never been less
non-stop.
Yeah. All right. Well, let's turn to a topic that I want to talk about today, aged care.
Yep.
Jason Falinski, this is a policy area that you're familiar with. Now, the government has said consistently that it put plans in place, it gave guidelines to aged care facilities. Knowing what we know now, though, more than 300 deaths in aged care facilities, do you think that you can confidently say those plans were comprehensive enough, that they've actually worked?
Look, Jane, that's a really complex question, and I don't want to deal with it sort of with a soundbite. But the answer to your question is, are there learnings from the plans we put in place? Absolutely. Are there international learnings or learnings from other jurisdictions? Absolutely as well. Aged care, though, is a microcosm of our community. If you have community transmission, you are going to, unfortunately, have transmission in aged care. We've seen the best way to do it is to simply put an aged care facility in a bubble, not allow people in or out. The problem with that is that you've got people who are coming towards the end of their time on this planet and who want to see their friends and family. These are really difficult issues, and it shouldn't be treated as a political football as it has been. And I really think we have the best aged care system in the world, and anyone who wants to dispute this,
can you?
Yep, absolutely.
Is
Go
it
for
failing
it.
though? I mean, like you've got
No,
to
it's
admit
not
that.
failing.
But look,
No, I
don't
don't.
think this crisis actually exposes how frail the system is?
Absolutely not. Quite the opposite.
So we've had
go and look
plans
at our
for workforce.
Yeah.
So back in April, the government was handed a report on the Dorothy Henderson Lodge, the first cluster in an aged care home, and that said the biggest problem aged care facilities will encounter in the event of an outbreak is workforce.
Absolutely.
Basically, 80% gets knocked out.
Yep.
But none of that's taken up by Victoria. Look at St Basil's; they lost their entire workforce in a matter of days when there was a COVID outbreak. So you say there are learnings. Doesn't look like the lessons were learned.
Look, I think when you say that, that's in a very difficult position. There are now, I think, over 400 surge workforce available to go in. People can say that's too little, too late. I would argue that as we went along, we made those learnings. The report from the Dorothy Henderson House actually was that there was a person working in that facility for 5 days who was asymptomatic and spreading it. And once it's in an aged care facility, because of the nature of a facility, because of the nature of the people in there, because of the nature of the work, it's going to spread. So I don't know how to explain this any better. We have the best aged care system in the world. When you look at the rate of deaths in Australia compared to overseas examples, when you look at how we look at our people and look after our citizens' end of life, there is no nation that does it better.
Do you agree with that? Do we have the best aged care system in the world?
I've let Jason speak. We have an aged care system where the Prime Minister called a royal commission because of the failures in the aged care system. The people that work in our aged care system are heroes. They are amazing, the workers. But you can't call a royal commission because of failures and then say there's nothing wrong.
Yeah.
And you can't sit and watch what happened at Newmark House and other places and not say that what is happening now is an absolute tragedy that should have had a proper plan. Guidelines aren't a plan. Money for a surge workforce that doesn't actually get rolled out properly is not a plan. And it's a broken system.
Okay, so we have a Royal Commission handing down its findings in February next year. I mean, I suppose if ever there was a time
I've got to say, that Royal Commission, though, what they did the other week, where they basically called the Chief Medical Officer a liar, where they have gone on and on and on, they have little proof. I'm not entirely sure that a Royal Commission coming up with policy solutions to aged care was a good idea in the first place.
Okay, but
even saying that...
So this government called a Royal Commission, and now because they don't like what it said,
no, it's
actually undermining the Royal Commission and the Council
not this government.
Royal Commissions have, though, put forward policy solutions to problems in the past, and the Royal Commission itself has identified problems here. So if we are going to have, reforms to a sector, what an opportunity to do so. So what kind of changes do we need to see?
We've seen one of the real issues is insecure work and casualised workforce. And Jason talks about turning an aged care facility into a bubble. And you're right that it is so distressing for the families of people who are in there and people who are in there that they can't see each other. But one of the issues about the transmission is you can't make it a bubble because the workforce is so fractured that people can't give up shifts at work because they need them to be able to feed their families.
How do you solve that, though? How do you solve the issue that a lot of them are part-timers, casuals?
You actually have a proper plan. You don't just have guidelines and you don't say, well, actually, it's our responsibility, but I guess there's a public health crisis, so it's the state's responsibility. It's a matter of putting real money into the aged care system.
Were there issues, though, with the responsibility here? Because it is Commonwealth responsibility, state's responsibility for public health. So
but the issue with people working across multiple facilities has usually been within the same group. Also, that there is a large part of the workforce, no provider, no operator of an aged care facility wants to have people who are not full-time because of the way that they need to operate their shifts.
But they do because of the way the system is working.
No, that's
or not
absolutely
working.
Untrue because the workforce makes the choice that they would prefer to be agency nurses or agency carers.
True.
That is true.
I don't know how many of the nurses you've spoken to.
I have spoken to a lot of nurses. I spent 15 years in this industry.
Can I say something? Because I let you say quite a lot.
Sorry. Yeah.
I've had nurses
Please, continue.
from my electorate you know, who are very concerned, and were concerned at the very start because they were doing shifts in GP clinics or in hospitals, and also doing shifts in aged care facilities because that's what they had to do to be able to earn enough money.
Yeah,
and they are amazing people. No one thinks that anyone in the system wants people to suffer, but there are clear problems in the system that have to be fixed.
And there was certainly in the Newmarch House, the Dorothy Henderson Lodge review that said that the staff were distressed and frightened, as I think a lot of health workers would have been at the start. But, so Jason Falinski, just to finish, so you don't believe there needs to be any wholesale reforms?
Oh no, absolutely not. Sorry, I do not mean to suggest in any way, shape or form that the system is perfect. There's no such thing as a perfect system.
So how would you improve it?
Anywhere in the world? I think that you need to undertake, I think the Habitas program in Holland is a very good program that we need to look at and roll out. That looks at actually making aged care facilities more multifunctional than they are. Even things like allowing, we've now got clear evidence that co-locating childcare facilities with aged care facilities has an enormous impact on the residents inside that. If we're talking about this crisis at the moment, there are absolutely learning. Surge workforce is certainly one of them.
Which
identifying people. Yeah,
right.
Absolutely. But these are facilities, by the way, that are experts in infection control.
Okay, I'm sorry, I've got to leave it there. Because,
Can we also, just before we move from aged care, I know we've sort of alluded to it, but we do need to acknowledge the people that have died and their families. And it's an absolute tragedy.
313.
And it doesn't matter at what point in their lives they were at. Their families weren't ready for them to go, and they weren't ready for them to go in these circumstances. And fundamentally,
and the worst part,
that has to be.
Yeah, it is a major tragedy, and I'm very sorry. We can't even move on because we've run out of time. We spent the entire time on aged care. I'm sorry, question time's in about 4 minutes' time. So I'm going to have to leave it there today, but thank you for the very passionate debate.